patients lose weight on GLP-1s. The question the trials only recently answered is what happens when they stop. In STEP-1, the semaglutide trial that brought Wegovy to market, the average patient lost 16% of their body weight over about a year and a half. For a 200-pound starting weight, that's roughly 35 pounds. The medication held the weight off for the entire trial period. Then the medication stops. Within 1 year of stopping semaglutide, patients in the STEP-1 extension regained 67% of the weight they had lost. Tirzepatide patients in SURMOUNT-4 showed the same pattern. Patients who stayed on therapy in STEP-5 held their loss for 2 full years. What the trials show is straightforward. GLP-1s work the entire time a patient takes them. They stop working when patients stop. Tapering with lifestyle support produces smaller rebounds than cold stops. The clinical question isn't whether GLP-1s work, it's whether a patient and their provider have a plan they can stay with. Find a GLP-1 provider you can stay with. glp1clinics.org/quiz.